Hello, my name is Jessica Grenvik, and I will be discussing our manuscript titled Birthing Balls to Decrease Labor Pain and Peanut Balls to Decrease Length of Labor. What is the evidence? This article was recently accepted to publication in the American Journal of Obstetrics and Gynecology. Upright positioning and increased mobility during labor are thought to have several benefits. Research suggests that upright positioning, such as squatting during labor, may widen the pelvic outlet. A 2014 cohort study involving 50 pregnant and 50 non-pregnant individuals found that squatting, compared to dorsal supine position, resulted in a significant increase in the transverse diameters of the pelvic outlet, with the bituberous diameter increasing by 0.9 centimeters, or 6.6%, and the bispinous diameter increasing by 1.9 centimeters, or 14.3%. The authors postulated that this increase may facilitate optimal rotation of the fetal presenting part during the second stage of labor. A computational model of the pregnant female pelvis also demonstrated a similar increase in the transverse diameter of the pelvic outlet in squatting position. However, the model demonstrated that the greatest increase in diameter occurred during the dynamic descent from standing to squatting, supporting the idea that maternal mobility and position change during labor may facilitate optimal fetal positioning in the pelvis. By widening the pelvic outlet, upright positioning during labor is thought to decrease the length of labor and promote spontaneous vaginal delivery. However, the evidence for this is mixed. A 2013 Cochrane systematic review found that upright positioning compared to recumbent positioning was associated with a decreased length of first stage of labor by 1 hour and 22 minutes, and a decreased relative risk of cesarean delivery. There was no difference in length of the second stage of labor. In another 2017 Cochrane review, no difference in the length of second stage of labor or risk of cesarean delivery was noted. Based on these reviews, upright positioning can be offered to laboring individuals as it may be associated with a decreased length of first stage of labor and does not seem to significantly affect mode of delivery or the length of second stage of labor. The American College of Obstetricians and Gynecologists supports frequent maternal position changes to support maternal comfort and facilitate proper fetal positioning. Therefore, it is reasonable to incorporate any interventions that can promote maternal mobility and upright positioning in labor. The birthing ball and peanut ball are two nonpharmacologic interventions that have been used by nurses and midwives since the 1980s with anecdotal success. They are thought to mimic upright positioning and promote improved mobility in labor. Therefore, they are thought to have similar benefits to those interventions, which we just covered. This article aims to review the existing best-level evidence regarding use of the birthing ball and peanut ball in labor. The birthing ball is a round plastic exercise ball that can be used for sitting, bouncing, and moving about during labor. Many nurses and midwives use the birthing ball for those laboring without an epidural to potentially improve comfort and allow pregnant individuals to perform exercises such as rocking back and forth and pelvic rotation, which is thought to widen the pelvic outlet to facilitate labor progression. Given its anecdotal success, the birthing ball has been a recent area of research interest. A 2015 meta-analysis included 3 randomized controlled trials involving 220 individuals laboring without an epidural, randomized to either the birthing ball or no birthing ball. This review found that the use of the birthing ball was associated with significantly improved pain in labor, reported on a visual analog scale of 1 to 10. Another 2022 meta-analysis of 7 RCTs, including 533 pregnant individuals, found that pain during active labor, reported on a scale of 1 to 10, was significantly reduced by 1.7 points in laboring individuals who used a birthing ball compared to control. Use of the birthing ball was not associated with significant differences in length of labor or in the rate of cesarean sections or operative deliveries. While it is uncertain what a decrease in pain by 1.7 points may mean clinically, it is reasonable to assume that even a small subjective pain relief may improve overall maternal experience during labor without resulting in adverse outcomes. How the birthing ball decreases pain is not well understood, but it is thought to be similar to the gate control theory of pain. An example of this would be if you stub your toe, a nociceptive stimulus, you can then inhibit the pain response with a non-nociceptive stimulus, like rubbing your toe with your hand. The peanut ball is another type of plastic birthing ball that has been used by nurses and midwives for individuals laboring with an epidural, as it can be used when mobility is more limited. Unlike the traditional round birthing ball, it is elongated and pinched in the middle, like a peanut shell. This unique shape allows it to be placed between the legs during labor when lying in a lateral recumbent position after epidural placement. This allows for bent knee positioning that can mimic a squatting position and facilitate frequent optimal position changes during labor. Over the past several years, there have been small studies and reports suggesting that the use of the peanut ball may decrease length of labor and reduce the C-section rate. However, the data are mixed. A 2019 systematic review and meta-analysis reviewed 4 randomized controlled trials with 648 term pregnant individuals laboring with an epidural, randomized to either peanut ball use or no peanut ball use. It found no significant difference in total length of labor, mode of delivery, or neonatal outcomes. A more recent 2022 meta-analysis included 4 randomized controlled trials involving a total of 818 laboring individuals randomized to either peanut ball or no peanut ball while laboring with an epidural. It found that use of the peanut ball compared to no peanut ball was associated with a significantly shorter first stage of labor by almost 90 minutes. However, only 2 RCTs were included in this analysis, so it is difficult to determine its true effects. The 2022 meta-analysis did find a significant increase in the likelihood of vaginal delivery in the peanut ball group compared to the control. There was no significant difference in rate of cesarean delivery or operative delivery, and neonatal outcomes were also not significantly affected. As you can see, current evidence is limited by small sample sizes of the trials, so caution must be observed when interpreting this data. However, the best level evidence does suggest that use of the peanut ball may be associated with decreased length of the first stage of labor and increased incidence of vaginal delivery. In summary, both the birthing ball and peanut ball are simple, low-cost, safe interventions that can be offered to laboring patients. Available evidence is limited, and further research is needed to determine their true effects. However, after reviewing the best quality evidence available regarding use of the birthing ball in labor, we feel that the birthing ball is a safe, non-pharmacologic option that can be offered as an adjunct to other pain control strategies for individuals laboring without an epidural. After reviewing the best quality evidence regarding the use of the peanut ball in labor, we feel that the peanut ball is a safe tool that can be offered to individuals laboring with an epidural, as it could potentially decrease the length of labor and promote vaginal delivery. Thank you for your time, and I hope you enjoyed the presentation.